Hi, this is Walt West, MSN 588. This is my uh, patient assessment for abdominal assessment and musculoskeletal. This is my lovely wife, Kathleen, our two dogs. Uh, we're using my wife's huge panel. It's got a camera on top of it, and this is a remote for it. And it's been kind of glitchy, so she's going to hold on to it in case the camera starts to move around or whatever, just so we know. And then I'm going to use this as my stethoscope today because I'm a dork and I left mine at work last night. So first thing, when it comes to abdominal assessment, it's a little bit different than normal. Normally, we inspect and then palpate and then inspect, palpate, auscultate, and then percuss. But with like abdominal and stuff, we don't want to percuss and palpate because on their abdomen before we auscultate because it can cause them pain, and it also can like alter their bowel sound and stuff like that. So we inspect, then auscultate, then percuss, and then palpate, and kind of in that order. Um, right, move that way, Bob. So I would have my patient in a gown, and then inspect her abdomen, which is basically at the or is in between the rib cage and the uh, diaphragm and the lower part down here before the pelvis. So first thing I would do is inspect and look at roughly the contour of her chest wall and how what the shape of her abdomen and stuff like that. Looking for masses, not masses, I'm sorry, discolorations, scars, moles, things like that. I would look for any like pulsations, which could mean a triple A. I would also um, look at her umbilicus and make sure that there's nothing wrong there. Um, Lastly, I would start to look for hernias. You can look in the inguinal area, and you could also look up here and around the umbilical and the if hiatal hernias would be more up here. Um, then I would auscultate. So I would listen with my stethoscope, and I would start down here in the right lower quadrant. Listen for, you could have, sometimes you might have to listen to up to 5 minutes to listen for bowel sounds, but so I would listen for bowel sounds here, and then from there I would move up to the right upper quadrant, and then across to the left, and then down to the left lower quadrant. From there, you can use the bell of the stethoscope to listen for like certain arteries. So like that you can listen for the aorta, which is basically comes down the midline of the body, and then it's kind of splits off and bifurcates into the iliac arteries at the umbilical cord. So I'm sorry, the umbilicus. So then I can listen for her aorta, and it's going to be kind of a dull sound. And then I could listen for her iliac arteries. You could try and listen back here for the kidney, the renal arteries on either side as well. Um, Kind of have to push pretty good to hear that though. Um, so then I could also listen to her femoral arteries, which are in the groin area. Palpate first, and then kind of put the stethoscope right over the top of that. Um, So then, once we've are palpated, or I'm sorry, auscultated everything, then we would percuss. I would use my left hand over on as my hand on her abdomen and tap with my right hand. We would start in the right lower quadrant, and you're listening for like dullness, but normally it should be timpani, and then I don't know if you can hear that. Um, so then we could also percuss for the borders of the liver and the spleen. The spleen is sort of like on this left side, kind of like around rib 10, and you can kind of palpate for that. Uh, and it should be duller. And then for her spleen, you're gonna be, it's kind of over here near these ribs. Palpate for that. From there, we could try and find the gastric bubble. It's kind of like in this like epigastric, slightly like left side here, and it should be a little more tympanic than, or I'm sorry, duller than other areas. Um, So then we've done inspection, we did auscultation, we've done percussive now. We would palpate and we would palpate both light and deep, and we're going to palpate all four quadrants. We're looking for guardings would be like muscle rigidity. If she does that, we're feeling for any like masses or for any pulsations or anything like that. And we kind of just start lightly, asking if this hurts or not. And I'm kind of like, I've got my hand and then I'm kind of pressing with this one. Um, from uh, from there, we could palpate deeply, and we're gonna try and palpate her liver. We'll also try and palpate the spleen, and then we'll try and palpate the kidneys that are kind of retroperitoneal. And you're gonna kind of like grab underneath and kind of palpate pretty deeply. So for the liver, you're gonna push down pretty good, and you're gonna try and feel for the liver. Okay. And then for the spleen or over here. Okay. And then for the kidneys, you're going to kind of like get back here and kind of like palpate in here for the kidneys. And then I could feel for femoral pulses in the groin area, looking for strength, +1, +2, +3. We could also palpate the aorta. Obviously, the older the patient is, or the skinnier the patient is, you might be able to identify a little bit easier. But you're gonna like press down gently, and I can feel that underneath my hands. And then we could try inguinal or the iliac arteries, but those are a lot smaller and they're much deeper. From there, again, we feel for femoral pulses, and we're done with the abdominal evaluation. And then since she's already laying down, I'm going to, for the kind of do the musculoskeletal a little backwards because she's already laying down. I will just do her lower body first, and then we'll do the upper body after that. So, we're going to look at her legs, inspect, and see if there's any gross deformities, any, moles, lesions, wounds, scars, anything like that. So to look for both symmetry over her body. Look to see if she's got her legs are equal. We'll just kind of start from down here. I would look at her feet. Toes look good. Nails are pretty. There's no scars or wounds on her ankles. I would test her strength. Can you push down, pull up? Okay. Those are both +5 easily. And then ask her to like, can you rotate your ankles for me? Yep, rotate the other way too. Okay, perfect. Awesome. And then just palpate around, feeling for any pain or tenderness that I might be able to find. Have her flex her toes. Okay. That's extend, that's flex. Thank you, ma'am.
Okay.
And then from there, kind of like move up, feel on her lower calf, and I would do it on the left side as well. And then up towards the knee, make sure the patella is in the place, palpate around the patellar tendon and the femoral tendon, or patellar tendon, femoral tendon up here that connects. Now, my wife's had a meniscus tear and had this repaired, so I'm going to show you McMurray's test, but I'm not going to get all crazy. So McMurray's test for meniscus tear, and what you do is you're going to flex the knee up like this, and you turn the foot medially while you bring the knee part out laterally, and then you're going to move it up and down like this, and you're like trying to feel for any like crepitus or popping or anything like that. You're also kind of like trying to listen for that as well. And leaning this out here and pushing this in does the medial side of the meniscus. And then you'll come in and turn the foot exteriorly like this or laterally, and then push the leg medially in and move it up and down. And then that feeling for the popping or sounds, anything like that, to tell you if the meniscus is injured or not. McMurray's is pretty, I think it's specific, but it's not very sensitive. So if the sign is there, then it's pretty good it's there. But if it's not, it doesn't necessarily mean that the meniscus isn't injured. From there, look at her femurs. Those look good. I'm going to ask her to lift her. Can you lift your leg up all the way up? Thank you. Can you bend your knee? Okay, awesome. Can you pull your knee towards your hip? Pull your leg towards your hip. Okay, great. Now push away. Okay, perfect. Okay. Can you push down off your leg? Okay. And now lift up. Okay. She's got good strength in her leg. I'd say +5, even from extension and flexion. Her hips are symmetrical. I could feel for radial or femoral pulses again. I feel for popliteal pulses back here, pedal pulses down here, and then posterior tibialis pulses. And you do that both sides, feeling for strength and seeing if there's a difference or not. From there, I'd probably help her up and have her stand so we can assess her spine. I'm going to go ahead and turn this away from me. So then I'm just looking at overall posture. She's not like kinked off to one side or the other. I'm looking to see if there's any scoliosis or anything like that. And then I'm looking for any discoloration of skin, scars, moles, things like that. And then I would palpate down her spine just to see if there's any step offs or if there's any pain or tenderness or anything. And then have her do range of motion. Can you bend over for me? Any pain there?
No.
Okay, go and stand up. Can you extend so you're gonna lean back? Pain? No?
No.
Okay. Can you turn to the right and turn to the left? Okay, and then can you like reach down to the left and reach down to the right? Any pain or anything like that?
No.
Okay. So we're already here, so I would probably go ahead and look at her, inspect her back of her neck. I don't see any scars or lesions or moles or anything like that. There's no skin discolorations, anything like that. So I could palpate the back of her neck for any pain or anything like that. I also could palpate her head. I'm looking more for like symmetry. Overall, her head looks like symmetrical to her on both sides, and also size wise, she's proportionate in for her body type. I would palpate the individual bones, occipital, the temporal, the parietal, frontal, just to make sure there's feel for any gross deformities, crepitus pain, anything kind of like that. And then from there, we kind of go down. We could go down to the shoulders. Have her. Can you look at her arms overall? I don't see any wounds or lesions or scars or any moles or anything like that. There's no gross deformities to her arms on either side as well. So that at this point I would have her, can you shrug your shoulders for me? Okay, put that down. And then go ahead and try again. Okay, she's got good strength there. Can you watch the fan? Can you raise your arms all the way up for me? Okay, great. Go ahead and let them down. And then can you go ahead and raise your arms up again? So here, okay, I'm push down, pull, lift. Okay, now pull them towards you. Okay, she's got good strength. That's +5 in her shoulders. Okay, go ahead and bend your elbows for me. Okay, and then I don't let me pull you away. Okay, now push me away. Okay, great. And then she's got, look at her hands. They all look good. There's no deformity in her elbows or hands or anything like that. So that at this point we would do NIRS, and we could do the Hawkins test. Both of them test for impingement in the shoulder. So NIRS is done from back here. I'm going to push down on her scapula here and then raise her arm here. And if a positive reaction would be pain in the shoulder. And then for Hawkins, you bring their arm up here, cross it over, and then you're gonna bring this under, and then you're just gonna gently turn the arm toward you or down. A positive test would be pain on internal rotation. We could test for carpal tunnel. There's a couple of those. We could do Phelan's. Go ahead and take your hands and put your palms like this. Okay, we do that for like a minute, and then we're looking for any like numbness or tingling, and that it's coming from the median nerve. And then we could do Tennille's test, which is you would put their hand down on like a hard surface, and then you're going to basically tap on the median nerve from the middle finger down through their hand. And you can tap all the way up to the elbow, and you're looking for any like paresthesia or numbness, a tingling type sensation from them to see if there's anything. A positive test would be that sensation, and it means that the median nerve is blocked. Same thing with Phelan's test. It would be blocked, and you may need to get surgery for that. Shoulders, hands, legs. I think we're good. Head, shoulders, knees, and toes. I'm good. Thank you. You guys have a great day.
All right, so yeah, you need to stop your recording. Here. So stop.